Okay, so hi everyone. I want to thank you all for joining the webinar today and for your participation, especially those who got up really early or are staying up really late. The webinar is being hosted by the Stockholm Environment Institute, other known as SEI, and the SuSanA Secretariat, and this is part of a grant to SEI funded by the Bill and Melinda Gates Foundation. And this webinar is also the first in a recurring series that we're hoping to do on SuSanA at the end of the month. So if you would like to share your work, we're hoping that you'll get in touch with us, and I'll also add my email to the chat window so you can contact me directly. And we'd also like you to participate in the webinar today, so you can turn on your webcam and your mic. I'll turn off the mics during the presentations, but otherwise you can ask questions, and we'll have time for a few questions after each of the two presenters, and then more time at the end for a general discussion. So today we'll be hearing from two speakers, and they'll present their perspectives on how we can improve WASH behavior change. And first we'll learn about leveraging the influence of community leaders. This is presented by Erin Swearing of the Results for Development Institute. And Erin is a program associate in the Results for Development Institute's WASH initiative, which is called the WASH Impact Network. The WASH Impact Network brings together civil society innovators in the WASH sector in India and East Africa for skills building and peer learning opportunities. Results for Development works closely with regional partners in Dasra, India, and the Millennium Water Alliance in East Africa to connect with WASH innovators in the two regions. And after Erin, we'll hear from Hannah Woodburn. Hannah is the Secretariat Director for the Global Public-Private Partnership for Hand Washing. This is a coalition organization that promotes hand washing with soap as a way to fight preventable illness and death. And Hannah will discuss how learning and exchange about behavior change can take place on the SuSanA platform and further through the SuSanA network. So we'll get started first with Erin, and we'll open up her slides. So Erin, you can go ahead and just let me know when you'd like to advance the slides, and I'll help you with that.
Okay, thank you so much. Hi, everyone. So I guess I'll just go ahead and get started. So the title of my presentation is Social Influencers, Working with Community Leaders to Influence WASH Behaviors. So you can go ahead and advance now. Okay, thank you. So this presentation follows a discussion that was held on the SuSanA forum, and this discussion was titled Working with Community Leaders to Change WASH Behaviors. It was held from April 14th to the 22nd. It went a little bit longer than that because people were so engaged and wanted to continue the discussion, but we had like over 25 replies and a lot of views on the content. And there was engagement from researchers and program managers. Yeah, next slide, thank you. So why have this discussion? We know that the software aspects of WASH must be addressed in order for WASH programming to be successful, but there are strong social norms and cultural norms that can hinder this process, and it can create a challenge in WASH programming. Strong social norms and cultural norms can shape the belief systems. So for example, in India, where access may be high to sanitation in some areas, it may not be utilized due to strong belief systems. Bangladesh was able to spur a social movement that challenged this belief system and kind of changed the way that latrine use was viewed and open defecation was viewed. While this is the case, in WASH, there's little research about social ties and influence. Natural leaders can be excellent resources in WASH behavior change, but often they tend to be excluded as activities focus on appointed leaders or existing WASH policies. They also fail to be included in WASH behavior change activities outside of community-led total sanitation. Next slide. Can you go to the next slide, please? Thank you. So what we asked on the forum, these are the questions that were asked. What are some of the opportunities and challenges around working with community leaders? How can we do a better job of leveraging their influence in a community to address some of the social and cultural norms that prevent uptake of healthy wash behaviors? And so I can just read the questions if anyone wasn't able to participate in the discussion. So the questions that we asked on the forum were, what are some of the opportunities and challenges around working with community leaders? How can we do a better job of leveraging their influence in the community to address some of the social and cultural norms that prevent uptake of healthy wash behaviors? The first question that we asked was, how can community leaders play a larger role in efforts to achieve universal adoption of healthy wash behaviors? What can we learn from working with natural leaders in community-led total sanitation that can inform how we work with them and other wash approaches? What are some of the challenges of working with natural leaders, and what are some of the challenges of working with appointed leaders? And also, what are some of the best practices for working with natural leaders, and what are some of the best practices for working with appointed leaders? Next slide, please. Thank you. So some of the insights that we gained from the contributions that were made on the forum, a lot of people commented kind of sharing their experiences working with natural leaders in community-led total sanitation, also school-led total sanitation programs. And so for some of the advantages and also disadvantages of working with natural leaders include they can serve as checking points to appointed leaders. They can kind of support their efforts. A lot of times, natural leaders, appointed leaders have other priorities, and so they can kind of keep them on track and make sure that they meet their WASH targets. In addition, natural leaders can work as partners with other religious leaders, whether it's school leaders or other people of cultural influence. And as well, their natural leaders are also known to kind of be self-motivated. They kind of are less prone to corruption and to be coerced to promote behavior change. In contrast, appointed leaders only have restricted time periods of influence. A natural leader can have influence on a community for a longer period of time, depending on the structure within that community. Especially in rural communities, natural leaders are not prone to leaving, which is different than urban communities. And then also with appointed leaders, sometimes there can be a lack of trust, and that trust is established based on previous political decisions that are sometimes external to the WASH structure, and so that can kind of be difficult in situations where the community does not trust the appointed leader. As well, there could be a lack of will to achieve the WASH goals due to competing priorities as well. Appointed leaders do come with a certain amount of legitimacy, so they can quickly be seen as sources of influence because they were appointed and voted on in certain situations depending on the structure in the community. And also, they can be more instrumental in forming business connections with communities because of their status. And so these business connections can provide access to a lot of different sanitation products. Next slide, please. Also on the forum, there was some interesting research shared and also some very interesting training models that I think were kind of new and innovative. So for the research that was shared, it was research from Johnny Crocker, Jennifer Bogle, and Ryan Rowe. And this is from the Water Institute, the UNC Water Institute. And so in those examples from Kenya, Ghana, and Ethiopia, health extension workers, they gave examples of the health extension workers in Ethiopia and Ghana, and they were organized on a government level using national policies. And that was an example of how they could still be natural leaders but still have government organization and still prove to be very successful. Also, the health extension workers kind of in those particular countries can contribute their success to implementation funding from donors and NGOs as well, just due to some resource constraints. Also, as an effective training model that I thought was particularly innovative was that there was a program in Cambodia called Civic Champions, and it was conducted by Watershed, and it's a 9-month leadership program that is a paid program. So I believe that the program cost at the time when it was being done, it was $35 US for participants, and it provided training for natural leaders. and participants paid their money to enroll in the program, got the 9 months of training, and then at the end of it, the leader that had the best sanitation uptake or open defecation free status in the community was recognized by his peers, and there was a trophy presented. And so it's just kind of a different way that we can think about kind of leveraging natural leaders. Next slide. So the discussion also brought up some remaining questions. Some of these were brought up by the participants in the discussion, but some of them were also things that we discussed at Results for Development Institute. And so the first question that I had, or that we had, was if natural leaders are beneficial in the implementation of CLTS, what are ways that we can work with them in other wash behavior change activities? It was mentioned that in hand washing, there seems to not be a big utilization or working with of natural leaders, and kind of we need to think about ways that we can include them in that as well. It was also mentioned that health extension workers were most useful in implementing CLTS. So what were the traits that health extension workers have that should be considered when looking for natural leaders? Is there anything that we can learn from working with health extension leaders in the implementation of CLTS? I know that based on that example that was presented earlier, a lot of their implementation was due to donor funding and NGO support. And so if that is a particular model that could be mirrored in other wash behavior change activities, then maybe we can think about ways to kind of mirror that model. Also, how can we leverage natural leaders in urban settings? As I mentioned earlier, natural leaders in rural settings work well because they kind of are staying in that area, and also the cultural and kind of social ties are a little bit stronger. When you move into a city, there's more, people are more transient, and also people don't necessarily live within their formal family units, and so kind of thinking about different considerations that need to be made and kind of choosing natural leaders to promote sanitation uptake. We need to think about that a little bit more. And then also, what are the benefits of looking to schools and religious centers? Is there any preference over either one of these? And kind of, are there any other sources that we haven't thought about for natural leaders? Next slide, please. And so that's all I have, and that's all that was based on the discussion that was had on the SuSanA forum. So if any of you all participated, just want to say thank you. And if you'd like to learn more about the WASH Impact Network, just please visit washinnovations.r4d.org. Thank you.
So thank you very much, Erin. And I would like to open it up with questions for Erin. I see a question here from Lemlem, and this is regarding incentives for leaders. How can you address the fact that people might need some kind of incentive to take on this role? So maybe, Erin, if you could start with that question, and then I'm open it up for others to ask questions in the chat window below.
Okay, sure. Oh, yes. Can we move back up to the remaining question slide as well?
Sure, yeah. I've turned on mic rights for the participants as well, so if you'd like to add a question that way, you're welcome to as well.
And so the question was about kind of giving incentives for being natural leaders. I think that the example, okay. I think that the example,
I can read the question out if you'd like. So Lemlem says that most communities that I've worked in are highly dependent on incentives, and if they are not paid, they are not committed to work. The problem is after the project is ended, there is no sustainability, and their intention will be diverted to other things. And there's another comment from Kamar following that says, in a humanitarian setting such as a flood-hit area, this is a genuine problem.
I think that is definitely a real concern. And so kind of some of the limitations that were listed for the example in Cambodia was that even though some people paid, they still dropped out of the program. So I think that just shows that that the motivation to participate kind of varies in that situation, even though they are paying to kind of become a leader. If they're not intrinsically motivated to do it, then then that's not going to continue. I guess we just need to think about different models that could be used, and incentives could not, they always don't need to be monetary. There could be, you know, status incentives as well, and kind of like earning the respect of the community. And so sometimes that can kind of be something that remains a little bit longer than those monetary contributions. So I think if they gain the respect of the communities and they're still continuing to live there and have that influence and status, I think that that's something that will last longer and kind of be a better incentive than monetary ones in that situation. Another question?
Great. Yeah, we have another comment from Aida from WaterAid. I can just read that one out. WaterAid's experience from the Sustainable Total Sanitation Project in Nigeria is exploring the fourth option on your last slide, and looking to explore more opportunities of working with stable leaders with responsibilities and connections with the communities instead of the typical that emerge from triggering process.
So when you say stable leaders, what would you consider to be a stable leader?
Great. Okay, thank you very much, Erin, for the very interesting conversation. I find it a bit, natural. When we started with CLTS, from my experience, our own idea was, of course, to develop natural leaders in the light of what you just described, but increasingly we're finding, because of issues of incentives and sometimes political and social situations within some communities, that the natural leaders that emerge from a triggering process, as the handbook suggests, we're finding them being inadequate in the dispensation of their roles and function as natural leaders and guiding the community, working with the community to attain ODF and sustain it. And particularly the case I was referring to is in northern Nigeria, Jigawa, where the population will find the young people normally would go into the cities when it's after the harvest season, the planting season and harvest season, to look for other jobs. And during triggering sessions in communities, you'll find that these are the ones who would emerge because they are young, they are agile, they are engaged, and then we pick them as natural leaders, give them the necessary trainings and all that. But they're not always in the community. That's what's leading the team in Nigeria to explore how do we then work with more stable leaders as teachers in schools that are resident there that won't be going in and out, religious leaders as you indicated there, the traditional leaders. We actually, I'll try to find a note and share. We did put up a short story about where the community started working with the traditional leaders and their officers that work with them. So those who never leave the community, they normally are political, they don't take sides during political events and all that, because these young men and young women that emerge sometimes belong to a certain political party and they can't go to a certain area or corner of the village when politics are rife and all that. So we're finding that it's been more successful working with the traditional heads as the natural leaders. That's kind of reinforcing their responsibility to the communities at the same time, you know, being there and supporting everyone to achieve open defecation free status and, you know, sustain them. That's what we're finding, rather than the traditional one of picking people from the initial contact sessions and triggering sessions as natural leaders, who had a number of challenges with those here. Thank you.
We have another couple questions here. One question from Chris. Maybe you can introduce yourself as well, Chris. How do you deal with competing religious leaders from different church denominations, for instance? And then a follow-up question here from Hannah. This one is about how to manage competing priorities or limited capacity of, in terms of time for natural leaders. So, Erin, if you'd like to take both of those. And if anyone else would like to comment as well, you can put your hand up.
Yeah, that's what I was going to suggest, is to hear from more of the practitioners on these questions and kind of see what you all think about them, if that's okay.
So if anyone would like to comment, you can comment using your mic, or you can comment in the chat window. Go ahead, Elizabeth.
No, I was just wondering, you know, this point 3 in your slide, there was one thing that I was concerned about with the urban settings, and I felt that in the thematic discussion on the forum, nobody referred to it or addressed it, and I just wonder nobody working in these urban environments, or is it too difficult? Or so, what are your thoughts on that, and how are you going to take that further? Or if any of the participants want to say something about this urban situation where it might be much harder to find leaders because the communities are not so coherent, they might be split up and a bit chaotic compared to rural settings.
Go ahead, Ada.
Okay, thanks again. I find that very interesting, and we're risking taking a position here that may not be very popular, but I mean, again, from practice and experience, I'm really thinking we're still struggling with with successful application of CLTS in rural areas where it's most amenable, but the urban question is another thing entirely. On the same project in Nigeria, we're working in small towns which are not exactly urban, and the challenges have been enormous. We've tried different modifications. We've suggested and tried different modifications to CLTS approach. Modifications like, okay, triggering in clusters, working with gatekeepers, what we call gatekeepers like opinion leaders, even within the heterogeneous settings you would find in urban areas, and none of this is really giving us the intention or the results that we're looking for. So just throwing this out, as there's been a lot of experiences with, significant number of experiences with urban and CLTS. I'm yet to see a very, very successful model, and sometimes we shouldn't push some things too hard. I'm just thinking that maybe the model of working with natural leaders or behavior change campaigns and all that may just not be suited for urban communities. That's just my take on it I wanted to share. And this is really informed by attempts at different levels to bring that to bear with various adjustments. So we have a policy brief that would be published in a week or so from now. It will definitely get on SuSanA. You can read some of the details of the attempts we've made in Nigeria with regards to trying it out in urban and in peri-urban and small towns. Thank you.
Thanks, Ada. I think, so we have some ongoing questions about potentially competing leaders and the role of religious leaders, and also another question about managing competing priorities. So maybe we can keep those in mind, and then we can move on to the next presentation from Hannah, and then we'll have some more time for further discussion at the end. So just for those of you who have joined since the beginning, Hannah Woodburn is the Secretariat Director for the Global Public-Private Partnership for Hand Washing, and this is a coalition organization that promotes hand washing with soap as a way to fight preventable illness and death. And today she's going to be speaking a little bit about how learning and exchange can take place on the SuSanA platform and be furthered within the network. So I would like to invite Hannah now to start her presentation.
Great, thank you. So thank you all for the opportunity to speak. I don't have a PowerPoint presentation, but I hope that you all have seen the discussion on the SuSanA forum about the topic of behavior change and how we can better address behavior change within the network and on the forum. So my background is I am the Secretariat Director for the Global Public-Private Partnership for Hand Washing, and we work to promote hand washing and behavior change both in terms of advocacy and knowledge leadership. And on the knowledge leadership side of things, we really try to connect practitioners with the latest and greatest about behavior change as well as hand washing more broadly, and the benefits and how to trigger hand washing in communities around the world. So we all probably on this webinar agree that behavior change is critical to improving access to and practices around wash. And I think that's part of the background of why we think that there should be a greater emphasis on behavior change within the SuSanA network. So as we as a sector look to move from delivery of just hardware solutions, it's increasingly evident that the software component must be prioritized. So in December, a thread was posted on the SuSanA message board addressing the topic of under which SuSanA working group behavior change should live. So there was a conversation about if the topic should be included in Working Group 4, which is Sanitation Systems, Health and Hygiene, Working Group 9, Public Awareness, Advocacy, and Civil Society Engagement, or Working Group 12, Wash and Nutrition. It was also proposed that the topic should be addressed to the new standalone working group, so Working Group number 13, which would be addressed specifically to behavior change. And the thinking behind this is that within SuSanA, we need to be able to identify, share, and promote new and current methodologies, best practices in cases of behavior change in an inclusive way that addresses the components of water, sanitation, and hygiene, so not just hygiene, but also water and sanitation. So taking that kind of discussion as a jumping off point, a few of us began thinking about what a potentially new working group around the topic of behavior change could look like. And we based a concept off of previous concepts that were developed for the working groups with objectives and activities that include those around knowledge, research, and learning, networking, collaboration, partnership, and then policy and advocacy. So if there were to be a new working group that would address behavior change in terms of knowledge, research, and learning, we could foster learning by sharing experiences of organizations and projects that work on behavior change. And this could be both within and outside of the WASH sector, so have a single platform to share learning and thinking about behavior change and discuss how it could be applied to programs going forward. We could organize learning events such as webinars or thematic discussions. This is something that my organization has done, and so I think there's definitely a need for continued engagement in this way around the topic of behavior change. And then also we could use the platform to act as a sounding board and provide feedback about ideas and activities that were raised by working group members. In terms of networking, collaboration, and partnership, a potential working group could encourage collaboration and promote synergies amongst those who are working in behavior change. So we could have networking opportunities at the SuSanA meetings, a potential event around the Stockholm World Water Week, and then also develop and strengthen partnerships in those who are working in behavior change. So try to connect people who have similar experiences, questions, or ideas. And then also, finally, in terms of policy and advocacy, a potential working group that was focused on behavior change could raise the profile of behavior change within the network by advocating for it amongst other working groups, such as the ones mentioned before, and then also the WASH sector writ large. So this is kind of the broad framework in which we've been talking about how we can raise the profile of behavior change within the SuSanA network and forum. So the questions that I would like to pose to the group are, do you think that SuSanA can contribute to improving behavior change knowledge and practice in a meaningful way? Would there be resources, tools, and guidances that this group should focus on? And then maybe also even what behavior change related challenges do you face that we could help address? I think from my perspective, I think it'd be great to hear feedback from what other people think about the topic and if they think it would be useful.
Great. I'm just going to turn everyone's mic rights back on. Thank you, Hannah. I think you raised a lot of really interesting questions, and I hope now everyone has their mic rights on, so you're welcome to join the conversation. You can, okay, Elizabeth, you raised your hand. Go ahead.
Yeah, so thanks very much for that, Hannah. No problem. Yeah, I'm a big, I mean, I would really like to see this new working group. I think it makes sense to have a new working group to give it more profile and more visibility. And I see that people in the chat, like Chris, just put this thing about whether it's not cross-cutting, and that's been raised in the forum before, but I don't see an advantage in saying it's cross-cutting, because well, then what do you do? Even just simple things like communication. If we had a dedicated working group in SuSanA, I could send an email to that working group, like I sent yesterday an email to working group 9, you know, which has 1,500 email addresses, and it's just convenient. But if it's cross-cutting, then how do I address those people that have an interest in behavior change? So, yeah, I would really support that, having a new group, especially if you'd be keen to lead that, which may not have to be that much work, hopefully. One thing I'm always a bit struggling with behavior change. Often seems to be very closely connected to hand washing. But I think with this working group, we should try and make it beyond hand washing too. Like I know that you're working on the hand washing side, but behavior change could be all sorts of things. It could also be how you do your food hygiene or open defecation or other things. So have you thought about that issue?
Yeah, absolutely. Sorry, I'm just taking notes so I can think about these things later too. I totally agree that it shouldn't just be hand washing. That's the area that my organization focuses on. But I think especially if we're talking about things like wash and nutrition integration, safe practices around feeding, things like that, then absolutely there's behavior change components, and behavior change is cross-cutting. It does involve developing products, and it does involve changing environments and all of these other things. But I do think that having a single place where it lives would really help kind of make sure that it's not lost is a small component of other programs, but that we're making sure we really have a focus on it.
Great. Are there any other comments? If you'd like to use your mic, you can go ahead, or you can put your hand up. And we have one comment from Chris here that behavior change is just a term, but I would rather think about various methods as those are related to specific topics. We have Bella. You'd like to comment? Go ahead.
I mean, it's about opening a new working group, right?
Yeah.
That's what you discuss, right? And I mean, as much as I'm very much on behavior change and interested in that topic, I'm just a bit afraid if we open a new working group that we spread ourselves too thin, and that in the existing working groups, the question is, can that topic be accommodated by one of the existing working groups so that the energy will not be again distributed over too many groups. I'm just thinking that you know the structure within SuSanA so much better than me. I don't know it that well, but I'm always afraid because this is basically we meet the same people around this topic in webinars, in comments, and I'm just afraid, for example, I think it would also fit to the entire school health or wash in schools working group, if it could be connected there. So not to put it, if we open a new topic, it does not mean that there are automatically more people hooking onto that. It's just my question. You know it better, just to think about that. Sorry.
I think that's a good question, and that's one of the things that I'm wondering too is, I've had conversations with people that feel like they're involved in too many working groups, that they're not able to dedicate their attention to one. So I think that's a very legitimate concern. And you're right, I don't know that it would necessarily be a lot of new people who aren't engaged in other working groups already. But I think it would have a central place where behavior change would live within SuSanA.
I think it could also, hi, this is Emily with R4D. I also think that having a dedicated place for behavior change conversations can help clarify things for users a little bit. I think if somebody wanted to start a conversation about behavior change, it would be really unclear with the working groups as they are now to know where to put that conversation or where to start that conversation. And I think maybe having a dedicated working group can also help deepen some of the conversations around behavior change by just inviting people to think about it a little bit more deliberately. So for what it's worth, that's my opinion.
Are there other comments that people would like to add? We have some questions and comments as well in the chat window. Ryan asks, would other members find it useful if the working group offered a brief summary of evidence that exists for behavior change? And then Elizabeth says one task of a working group could be to interact actively with the other working groups.
Yeah, and I think that's something that I envisioned, was that it would be kind of a liaison role where it would engage with the other working groups because it is cross-cutting. We have a comment from Aida that having a dedicated working group may allow
may create the space for experts in that area to be really in their space and element and share freely without tagging along as cross-cutting for every other group. And Chris adds that for behavior change, it's always connected to another specific topic like demand creation or hand washing or toilet use, etc. Okay, are there any other comments on, I see there's some discussion at the bottom here, but I'd just like to take any other questions via audio that anyone might have. Okay, so if not, then I'm going to formally close the webinar and we'll stop the recording, but you're welcome to continue in the chat afterwards. I'd like to thank you all for attending, and I think this was a really interesting opportunity to learn about some work that's being done relating to behavior change and also future opportunities for building this kind of network. Since we're planning to do a recurring series, I hope to see many of you in the future. And if you're interested in sharing your own work or projects that you're working on, you're welcome to contact me. And as has been mentioned a few times, there's a thematic discussion that you're also welcome to join on the SuSanA forum. So thank you again, and I hope to see you all in the future next month.